Hi, this video is the art of hair transplant restoration surgery on a Middle Eastern man who has a class 5 hair loss pattern, almost towards 7 in the future. He's thinning from the front to the back. He has some residual thinning in the top, but this hair is on the way out. We're going to be harvesting at least 5,000 grafts by the FUT method, and you're filling from the front all the way toward the back. Hair transplant, as you know, is not a perfect science. Sometimes you might need more than one surgery to have perfect density. For this client, now we can start focusing on the hairline. Hairline is an art form. It requires lots of the artistic and aesthetic detail to ensure very natural results. So if you can look straight up, there we go, perfect. And we're gonna focus on the hairline. So on average, from the mid eyebrow to the hairline for Asian and black around 6.5 to 7, and for Caucasian it's around 7.5 to 8.5 centimeter. For this client, it's actually around 7.5 centimeter. Although we use the average height of each ethnic hairline as a guide, but really when we build the hairline, we build it according to each individual facial structure, as long as overall proportional, and as long as a third. From the mid eyebrow to the hairline is a third. From the mid glabella to the tip of the nose, a third. And the tip of the nose to the bottom chins is a third. And then not only he has some receding hairline, but his temple has gone back too. So he's not only, instead of shape going parallel, actually has a V pattern. So what we do, we not only lower the hairline, we bring the tempo as well. We turn here, we brought it around, a finger, index finger on the left side, if you can turn this way, and a pinky on the right hand side. How do we do the measurement? And when it comes to the hairline, I try to be as precise as I can. You try to be as close even as you can, but knowing that if you split the face in half, naturally no hairline can be identical. The more imperfect it is, the more natural the hairline will look, and that's very important to. So when the hairline comes out, don't be expected to be completely perfect and even. It's not normal that way. It's not natural. That's what I mean, not normal. So if a little bit slightly off, that's fine, because when the hair comes out, it can be very natural. So from the midpoint to the side, to the temple, on average, is around 7 to 8.5 centimeter. And for most of our client, we've got around 7.5. But not everybody can be exactly the same. For this client, we actually bring from here to here to the temple is around 8.5 centimeter. From the midpoint to the right side is 8.5 centimeter. And from here to here is around 7.5 centimeter. And then once we get the shape down, the more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. And no hairline straight, so we zigzag through it. As you can see, he has one straggler of hair here, and one or two here. So, that kind of gives us a clue where the hair was. And then the precise angle is important. We try a precise angle, start 35, 45 in the front, increase when you go backward, and change when you go a different direction. And then not only that, the selection hair graft. We transplant rows and rows, single hair graft in the front, followed by we go 2 here, 3 here, 4 here, and back for both volume. So I'm very excited for this young man, and we're gonna change his life. So 5,000 grafts, and next year he will look different. Thank you.